Hi, everyone. Welcome and thanks for attending yet another Facebook Live session with us here in Information and Referral. My name is Maria Marano, and I'm here with Shannon Harrison. Hey, Shannon.
Hello.
So Shannon and I both work in Information and Referral. I first started working in community development, so helping out with the support groups and overseeing those, and helping out with accessing community resources. And now I work helping and supporting the helpline that we have. So you can call into Parkinson Canada or email us at info@parkinson.ca. And Shannon and I and our colleagues answer those questions. Before I started with Parkinson Canada, I was studying as a Parkinson's researcher, and that's a bit about me. And Shannon, do you want to tell everyone about you a bit?
Sure. So I work in the Ottawa office. Oops, I'm wondering if I dropped out there. I'll just continue to talk. I work in the Ottawa office, and I am information referral. I've been there for about 3 years now. My background is nursing. And so yeah, answering people who call, people who've been newly diagnosed, people who've been diagnosed for a while, and have questions about Parkinson's disease. So this is what Maria and I do, and we also have another colleague in Montreal who also does information and referral. So we do have some service the French-speaking population as well. So yeah, we're glad to be here today. I'm glad that you're all with us. Well, thank you for joining us today.
Yeah, that's a great point. We also have services in French. It's important to mention. How are you doing, Shannon? How's your week been?
Been okay. Been busy. It's getting a little warmer today. I don't know, what's it like in Toronto there?
I haven't been outside today. It's been chilly. We've been seeing the sun, but I feel like it's a bit deceiving because it's been cold whenever we've actually stepped outside. Yeah.
The weekend's looking good, so that's important. So
that's true. The weekend's looking good. Yeah. Maybe thinking about going for a bit of a bike ride. I'm repping my Super Walk gear today.
Very good. Very good.
I started, so before I started working for Parkinson Canada, I started as a volunteer with Superwalk and those things. So over the years, I've accumulated so many shirts and things like that. I feel like all my quarantine wardrobe is courtesy of John and Amanda and the events team. So thought I'd wear one of the more professional ones for this, but yeah.
That's great. Oh, Superwalk's such a great event, and we just have a lot of fun in that. So looking forward to it again this year.
Yeah.
Sure. Yeah. So how's your week been?
Same, just super busy. Yeah. Lots of calls, but good. And felt good to be able to be helpful when we can, and, just connecting with our clients. And I think we need it maybe as much as they're reaching out to us. It's also nice for us to hear their voices.
Absolutely. Yes. And, people with Parkinson's always really amaze me how resilient they are, how they're managing, how they're, doing the best they can, just like the rest of us. Yeah.
It's true. Sometimes in talking to some of the clients, I'll say, are you okay? Do you have everything set up? And they're just like, we've always had to adjust, and this is just another, it's pretty incredible as we're sort of figuring it out for the first time. Some of our clients have really been teaching me some lessons as well.
Absolutely. I learn something every day, so which is good. And they're just so resilient. I admire them so much.
So just to explain for people who are tuning in for the first time how this is going to work, hopefully you guys are entering questions into the comments right now, and then we're going to be receiving those. So what we'll be doing is I'll be scrolling through those questions and looking at them, and then Shannon and I will try to sort of have a discussion to respond to those questions. So if you're seeing my eyes darting around the screen, or I have a concerned look on my face, it's just because I'm sorting through questions, so that's why. Some questions, this is going to be going out to a really general audience. We're not sure who's tuning in, so some questions might not be appropriate for that. If you're asking a really, really personal, specific question, I might tweak it a little bit just so that it can be more relevant to a wider audience. And also, just if we're busy, we may not get to all the questions today. But as I mentioned, we do have a phone line and an email address. So if you have any questions lingering, or you needed a bit more specific information to your personal case, just give us a call and we can do this on a one-on-one level. Um,
Sounds good.
so just before we get started, when we've kind of been chatting for a bit, I do just want to get through one part that's really important, and that is a bit of a disclaimer. This is a chat. It's just meant to really be general information about Parkinson's, and just to be clear that it isn't medical advice. You could ask a question through the chat about a symptom, and we could tell you about how it relates to Parkinson's and give you the perfect answer about how it relates to Parkinson's, but you might have a whole other health condition that doesn't come across through chat that we're not aware of. We're not doctors and we don't have your medical records. So whatever you're hearing here, you should always make sure you go back and connect with your healthcare professional before you start making any changes to your medication or treatment plans. We're on the phone with you guys a lot, so I know that accessing healthcare professionals is always a challenge, and especially during COVID-19 has been a problem. And so I definitely understand that that's not necessarily easy during this pandemic, but as just for the safety of all of our clients, as much as it might take more effort, it really is worth reaching out and talking to your doctor or your pharmacist before implementing anything that we're discussing today, just to be absolutely safe. That's safety number one for us. So with that, we're going to get started with some of the questions that we've receiving, and kind of along those lines, I think one of the biggest questions that we're getting, or just kind of the challenge that I think Shannon and I, we've been talking about how a lot of our client interactions lately are a lot longer, because it'll be even just a regular Parkinson's conversation that's now exacerbated by COVID-19. And one of the biggest issues is people not being able to access their healthcare professionals. Shannon, that's something, have you been hearing that as well?
Oh, for sure. It's definitely a concern for many people who say, well, I can't reach them. And I think we just really want to encourage you to keep trying. A lot of the specialists are getting online, doing either video calls with people, or they're doing telephone appointments. And I have had several people tell me they have connected with their specialist. So, keep trying to reach them, and with your concerns or your questions.
Absolutely. And I mean, there are some cases where neurologists or specialists aren't available, and they're referring people back to their family doctors. So also reaching out to your family doctor. And if that is a situation, I think this is something we discussed last week. Some family doctors, though, family doctors are these encyclopedias of information. They know so many different types of illnesses, but maybe don't have the same level of depth on Parkinson's as a neurologist would. So if that's a challenge and you'd like support in that regard, we can either email or send out mailings to family doctors to help them in managing your care during this time. So that's also another option. If your neurologist isn't available, we can also provide healthcare professional resources to the professionals that you are seeing as the alternative.
Yes, and I mentioned it last week. We do have the Canadian guidelines, which were just put out at the end of last year, and they're would be really helpful for your family doctor. So we can support you with sending that information to you to take to your family doctor, or make some kind of arrangement to get it to them directly.
Sorry, Shannon, you were a little frozen. Were you holding up the guide?
Yes.
Oh,
sorry about that. The connection may be a little bit bad. I apologize for that. We got the sound straightened out, but our internet connection is not very good today for some reason. But I did want to hold up the guidelines. Can you see them now, Maria?
I'm so sorry. I think you're frozen again. Oh, there you go. You see it. Awesome.
Okay.
Yeah.
Sorry about that. Our internet is giving trouble. So anyhow, these are the guidelines. So I'll just hold them up again so everybody can see them. And they are for healthcare professionals, for your doctor's office. So if you would like, we can send you a copy to take to your doctor, and they'd be really helpful just to bridge that gap if you can't reach your specialist.
Yeah, the guidelines are great. They are a huge lifeline, even for me, and I'm sure you as well, in answering questions, and just knowing especially what is info that we think is true versus what is stuff that the professionals, and it's not just movement disorder specialists. It's also other professionals that they've looped in, like physiotherapy. What are the experts saying is yes and definitive, and they recommend. So it's a big help for us as well. One of the other questions.
Oh, one more thing, we should mention about pharmacists, how they can be just a great resource too if you have questions about your medication. So reaching out to your pharmacist can be another good idea, just to have that support.
That's a great point, especially because pharmacists are a bit more accessible, especially right now, they're a bit more easier to reach by phone. Pharmacists are, I think, sometimes people don't realize the amount of support that they can get from a pharmacist. I know for me, and I've reached out on behalf of my parents and their stuff, that is, I think, an opportunity people don't realize that they can take, especially with medication interactions, how you're taking your medication. And as we know for Parkinson's, the circumstances around taking medication can make a big deal in how effective it is. So pharmacists can be really helpful for that as well. One of the other questions that we're getting a lot in our calls is people just feeling a little bit anxious, understandably, about isolation right now. A lot of our clients, especially because Parkinson's tends to impact people who are a little bit older, and we know with COVID-19, people who I think it's over the age of 65 are more at risk. So a lot of our clients are sort of staying more indoors than they're used to normally, maybe not being able to connect with their families. I know I've talked to a lot of clients who are, FaceTiming their grandkids instead of getting to see them. What are you hearing on the phones with regards to isolation?
Yeah, a lot of people are finding this has been going on a bit longer than we all hoped. But I think, you just have to make that effort to connect with people, whether it's on the telephone or speaking to them, doing some kind of a Zoom thing or FaceTime. It's not the same as being present or being present with somebody, but it is a good option for right now. So another thing that some people are doing are these sort of Zoom exercise classes. So a bunch of people together doing exercise together, which I think is really good because you can really connect to other people that are just undergoing and having the same difficulties. So.
Yeah, I think that's one of the things that I really liked, especially as you guys saw this week. Yesterday we had Randy doing exercises, and one of the things that's really hard, that I'm hearing from clients, and I know I'm experiencing, is motivation to exercise. It's kind of like, yep, I'll exercise, and then it just doesn't happen in the day, but kind of having that appointment to exercise. I'm going to do this Zoom exercise class. Parkinson Canada has this Facebook event. I have to be there for that. It is a form of accountability that's helpful to just make sure we're actually getting it done, because I know for me, I haven't been doing it enough. And yesterday I was peeling potatoes and my arms were getting sore. I thought, oh boy, I need to pick up the exercise. So I think, those kinds of things, just also for being an accountability factor, can be really helpful. The other thing that we have are, again, going on the Zoom or teleconferencing is Parkinson Canada. As much as they're not in person, we are still having support groups, virtual support groups in some capacity, either a teleconference or on video. So if you're feeling isolated, feeling a little bit cooped up and missing, especially if you were already part of a support group and feeling like you're not as connected with your friends, those options are still available. So if you're not sure how they're happening, give us a call or shoot us an email and we can get you set up. But that's another great opportunity, especially, it's a lot of the same facilitators, it's a lot of the friends that we're used to seeing, and that kind of consistency at this moment feels nice. It feels nice to be talking to the clients that we're used to talking to, and maybe for you guys as well, being at the support group and seeing the members of your group that you're used to seeing by phone or email or by video would be a good thing at this time as well. I started in support groups, so I just think they're the most amazing and the most helpful thing for clients. So if you were not already a part of one, definitely reach out to us.
Yes, I remember actually when I first started, somebody, I connected them to a support group, and it happened to be in our office, and then they came by my desk to speak with me after, and And they were just like, wow, I am no longer alone. Like, that was just the first thing she said to me. And she was just so appreciative of connecting with people that can understand some of the symptoms that she's experiencing. So
that's exactly it. The I'm not alone thing, I think, is so important. I know, and I think one of the reasons why this isolation is, it's not something completely unfamiliar sometimes to our clients. Sometimes our clients talk about, of course, with mobility challenges, it makes it a little bit harder to get outside on any day. That can be an issue. Sometimes clients are maybe a little bit sensitive, or worried about how their symptoms are being perceived. So this is always isolation can always be something we are considering for our clients, and so we definitely don't want that to feel exacerbated during COVID-19. But I think that's really the magic of the support groups. It's finding out, it's people with the similar experiences to you and knowing kind of what you're going through, even though it's not always identical. And I think that can be really, really important for clients. And also just learning tips and tricks of the trade. You have a little bit of an appointment with your doctor, but just how to go through life with managing Parkinson's. I always learn something that my clients are doing or using from a support group and think, oh, that's good to know. That's how I learned about ways to avoid stomach pain when taking medication and things like that. So they're also just great for that sense, the more practical tips for Parkinson's. And I see we're getting questions about, tips on that front. Pain medications, pain relieving medications, and what are the recommendations? So that is a tricky question. Pain can have different sources from Parkinson's. Sometimes, rigidity can be a symptom of Parkinson's, so muscle tightness. So it could be that could be a cause for pain. There can be other sources of pain for Parkinson's. And depending on the source, it can require a different approach. If it's muscle stiffness, let's say, that's the rigidity that's turning into muscle pain, a lot of stretching and a lot of exercising can be really helpful for that. Other people need different approaches. I'm not a doctor, Shannon, you may have a bit more info on this, but just from experiences of helping individuals with pain, there seems to be a medical sort of hierarchy and certain steps that you go through as far as pain management. You don't just start at the most intense medication, because those can have a lot of side effects. So you work with your doctor to kind of build up, whether exercise, sometimes massage therapy, those kinds of preliminary things, and then building up to progressively stronger medications. I think starting with Tylenols, and then your doctor's building on them gradually from there. I think, is that correct?
Yeah, I think that's really good, Maria. Pain is so individual to each person. Pain can be many things in people with Parkinson's. As you mentioned, that muscular pain. It could be a nerve pain, which is kind of a burning, tingling pain. So really, it is best to speak with your specialist about the type of pain so they can really narrow it down and figure out the best treatment for you. It's a great question, though, and pain is a big part of many people's lives, especially people with Parkinson's. And so be sure to talk to your doctor about that so they can really narrow down.
Yeah, I think that's exactly it. It's about narrowing down the source, and then and I think as much as it might feel a little bit stressful, we want pain relief as soon as possible. I want pain relief as soon as possible. I have loved ones who live with pain, and I want them to have pain relief as soon as possible. But sometimes, as much as we think is the best medication, sometimes the best at relieving pain has a lot of side effects, a lot of those, that make it hard to just go about day to day, hard to get outside, not able to drive, a lot of stomach issues. So it really is about that titrating. So you can go with the mildest form of medication that is still getting you the most benefit. And then also, is it about introducing non-medical or non-pharmaceutical interventions in there as well? So again, the exercise and the stretching can sometimes be really helpful for that kind of stuff.
That's right. Heat therapy.
For some people, especially another symptom that can be associated with Parkinson's, some individuals will get dystonia, which is a specific form of pain. And for those people, some people will even get Botox injections. And again, that's something you definitely work on with your doctor if that's appropriate for you. But again, it's just there's a whole wide variety of options, and it really depends on what kind of pain you're experiencing to figure out the best source for a solution. Other things that were, so actually this was a question that we received, I think after the fact. I was going through the Facebook page after our last session, and I think some people viewed it after, which is great, and there were some questions that we got after the fact, but one of them was a question just about how cognition is affected by Parkinson's and weight, what that looks like. Yeah.
Right, yeah, so cognition in Parkinson's is really, with Parkinson's, it's a slowing down. Sometimes that's what it is with cognition. It can be a very mild thing in that it takes a bit longer to process what you're hearing and what you're thinking. It may also be changes in multitasking, so not being able to do as many things at once as you used to do. And I have to laugh at that. I think we're all better off just doing one thing at a time anyhow and doing it well.
Yeah.
So multitasking becomes much more challenging with Parkinson's. And I also hear other people talking about problem solving, making decisions. Maybe they're just not quite as good or as quick at doing those things. Anything else you want to add, Maria?
Yeah, I think that really is a good summary. Just one thing I wanted to point out, and it kind of goes back to what we were saying about how resilient our clients are. So I was reading a paper talking about how COVID-19 could be impacting people with Parkinson's and causing challenges. And that was one of the things that the paper acknowledged. People with Parkinson's can sometimes, especially as Parkinson's progresses, have difficulty with decision-making and planning, and sometimes mental flexibility, so being adaptable. And that's one of the things that, just because of how the Parkinson's progresses through the brain, it can start impacting brain structures. Not motor symptoms we know are coming from the brain area that is related to movement that's being degenerated. But as Parkinson's progresses, other areas start to be impacted. And so they were acknowledging how that might make it challenging for people to deal with COVID-19. And I was reading that, and for sure I'm sure that's true. But again, going back to what I've always found with our clients, and what we just talked about, is as much as maybe being adaptable is more challenging for our clients, it's also something I think they're amazing at, because I think something we always hear from our clients is, they'll say, just when I thought I got Parkinson's working, something changes. And it's just that because the progression changes, it means symptoms change every couple of months or every couple of years, and they're always adapting. And so I thought it's ironic that that's in theory something that maybe isn't supposed to be something they're great at, but then really it's something they're doing all the time, every day. And something I think of clients as being amazing at, and just like we said, checking in on clients that we know and how are you doing? And they're saying, yep, we've always had to adapt, and this is just par for the course. I think for some people, some adaptations are bigger than others, and also some people are newer to Parkinson's, so they don't know yet that they're going to be able to adapt to the new challenges that they're facing, and that's where we can be helpful. But that just always is something I always think of whenever I read the stuff about cognition, is how strong we know our clients to be in those areas, even though that is technically a part of their disease that is causing them issues. I think with cognition, it's important to talk about the differences in severity of cognition. So there's something that's called mild cognitive impairment. That's something that can happen for a lot of people with Parkinson's, especially as they advance with Parkinson's, as it progresses. But it's again, those smaller things. It doesn't, I'm sure it doesn't, don't want to speak on behalf of someone. I'm sure it doesn't feel good to have that moment of not being able to maybe as decisively make those decisions and make those plans, but it's not something that fully impedes someone's day-to-day life. That's what mild cognitive impairment is. And then for some individuals, that will progress into something that's a bit more escalated, which is Parkinson's disease dementia, which is then where a person is not able to fully function in their day-to-day as smoothly. So that's when they're going to be requiring support because the cognitive deficits are so severe. So there are two distinctions between what clients can experience, and definitely those milder symptoms are more common for people with Parkinson's. And there are some risk factors. I know, Shannon, we were talking about this earlier as far as Parkinson's disease dementia. That's not something everyone will experience, and there's certain factors that make someone a bit more prone. Did you want to get into that?
Yeah, you know what, there's not everybody will experience that. They are saying that probably if there's an older age onset, there's more likelihood of having Parkinson's disease dementia, and also it may increase as the disease, the longer you've had the disease.
Yeah, exactly. So, oh, sorry.
Mm-hmm. No, I was just going to say, everybody is so unique with Parkinson's, and you've probably heard us say that over and over again. Not everybody has the same symptoms. But you know, your journey is going to be what your journey is.
That's a good point. Do you have, by any chance, I know you have the Act on Time kit with you. Do you have the Parkinson's disease summary there?
I do, yeah.
So when someone, especially someone calling for the first time, newly diagnosed, we give them an introductory package, and it includes this sheet that Shannon is holding up right now. It lists every symptom. Well, maybe not every symptom. There's a couple of unique, quirky ones that aren't on there. But the majority of symptoms that people could potentially expect to potentially experience with Parkinson's. And one of the things that I always tell clients if they're looking at this list for the first time is, this is the list of what could happen. Your intro guide has a list of all these symptoms from, you know, tremor to leg swelling to constipation, but it is really unique to each individual. And, you know, if you're reading, especially as you're going through our materials, they're meant to be thorough and they're meant to empower our clients with knowledge. But that doesn't mean that every person with Parkinson's is going to get everything on the list. And so if you're reading that and you're ever feeling a little bit concerned, don't be stressed out. And what I always say to clients is, if there's a symptom that you're reading about that's involved with advanced Parkinson's, some people are concerned about cognitive issues. Some people are concerned about swallowing issues or speech. Give us a call or ask them in the chat right now, and we can talk about strategies to prepare for that and work on those strategies. If you're starting speech language pathology training in advance, that can help with avoiding the extent of, let's say, if you were to develop speech issues. So there are things that we can do to work on these kinds of symptoms. So don't be discouraged by reading a long, scary list. It doesn't happen to everyone. And also we can try and work on things on an individual basis.
Mm-hmm. I'll mention too, on the back of this sheet is how to get the most out of your neurologist visit, which has really got some great tips. So it's a great sheet to have, and we can certainly send one in the mail to you. And they are on our website as well.
Mm-hmm. So Shannon, oh, sorry, go for it.
You mentioned the introductory guide. So again, this is, we referred to it again last week, and another really, really great resource. It's on our website. I just find it so comprehensive, and I refer to it so many times because it just talks about what is Parkinson's, what are some of the symptoms, what are the treatments, what can you do about it, what kind of medication options are there too. So that's a really good resource. Again, online. If you'd like a copy, then just call us and we can mail that out to you.
Yeah, just to guess a point about mail. So we're not, obviously, we're working from home. So we're not in our offices as regularly. So we are trying to be creative in thinking about how to mail out items. We will probably try to send people to the website first, just so they can have immediate access. But we're going to try to keep a list of people who are requesting mail items, and periodically, if we have coworkers who are popping into the office, we'll try and get those in get those requests out to them and see if they can mail those items out to people, just so we're not waiting till the full end of this lockdown. But just wanting to flag that mail is happening, but a little bit slower than normal. And so, and then also I think probably there's delays with Canada Post as well. So, you know, all we probably at this point, going to the website is your best bet to get immediate access to information, but we are trying to figure out mail as well. So you can email us questions if you would like something mailed, or, you know, if you know someone who maybe isn't able to tune into a chat, who needs a hard copy, we are working on getting those out as best as we can.
Yes, yeah, good point, Maria. We'll first send you the email version or the copy, link you to what our website, and where you can find that link, and then get that hard copy too if that's what you prefer later on. So unfortunately, we're doing the best we can right now, but there are some great resources. We do have a lot of good resources.
So one of the other topics that I asked Shannon for us to talk about, because I think it's one that I find with our clients, it's the one that they don't always hear about when they go to the doctor's office. And I find it's the one where I tell them, they're like, what? Eureka. It's kind of one of the Eureka conversations that we have, that I wish the info got out a bit more. And that's in relation to, that's the conversation around medication and protein. So for people who aren't aware, sometimes, especially as Parkinson's is advancing, protein and consuming protein in and around the same time as when you're taking your medication can sometimes reduce its effectiveness in your body. And the reason for that is if you were to break up your levodopa, your Sinemet, your medication into its fundamental chemical parts, it's essentially the same parts and pieces as protein. It's amino acids, just different, you know, combinations. And so what happens is if you're taking your pills and you're taking your protein, you're having a steak, you're having eggs, something like that at the same time, they're going into your body at the same time, but in our digestive system, they have to get absorbed. But it's kind of like if you have too many people going through one door at once, you're going to get a roadblock. And sometimes we find that the protein in food gets taken up more readily than the medication. So what happens is your protein is in the amino acids in your protein are getting absorbed, but not the medication. And so what people find is either it takes a lot longer for their medication to kick in, or sometimes it doesn't even work at all. And they're thinking, what happened? Why isn't this working yet? And I need relief from my symptoms. So, something that's just like a tip that I think is really important for our clients. If you're not aware of and you're finding that sometimes your medication isn't working as well as you'd like it to, and you think, oh, I am taking meds around meals and those meals include protein, that might be something to think about. And Shannon, can you walk us through a bit how that scheduling sort of works?
Sure, and I think it's really important. You still need to eat protein. I've had some people say, oh, okay, I'll cut out my protein. No, that protein is really important to eat. So it's really timing your medication around that. So the recommendations is taking your pill on empty stomach. So that'd be 30 minutes before your meal, 30 minutes to an hour before your meal, or 2 hours after your meal. That's when you take your medication. And again, speak with your pharmacist about that. If you're having trouble, like sort of with the timing of it, what time is best to take your medication, but it is better to take it on an empty stomach. You know, not everybody has the trouble with feeling that the protein is interfering, but it is a documented fact that many people do, and they say, you know, I cannot take this with maybe, you know, take it with my supper where maybe they may have the most protein. They really notice a big difference, how it's just not effective. It's not absorbing as well. And I like your analogy of the doorway, Maria. I often tell people it's like the protein and the levodopa, they want to get on the same train, and there's not enough room to get on the train to go into the blood. And if the train doesn't have enough room, so to get into to take the protein or the amino acids and the levodopa into the blood, and the protein wins out because it's stronger. And so they get absorbed and leave the levodopa behind. So, but I like the doorway one too. That's good.
I was going to say, I like yours better because a train is going in your, so that kind of carries the analogy better. It's getting into your blood, so then it's getting to your brain.
That's great.
That's a really,
Exactly.
I like that a lot. And also I take the subway, so it feels, and I go north to work. So that feels really,
That's
yeah.
good.
I'm going to change my analogy. I like that better. It's the train getting to the brain. That's really good.
That's
Yeah.
great.
I think that's a really good point. It isn't necessarily just about cutting out protein. That is definitely
Not.
some people are really creative in, you know, and some people will go see a dietitian and what has protein, what doesn't have protein. Some people can't take their medication on an empty stomach, so maybe they'll have it with, you know, something that's more carb based or something, you know, like applesauce or crackers. And then again, with that half hour before protein or 2 hours after protein, some people, because, you know, most of us are taking our medication during the day, maybe they'll take their medication and then they'll save up the protein for the day as their meal that they have after they've had their last dose, different things. And again, maybe talking, you know, if that is an area of concern or you want a good schedule, talking to a dietitian to make strategize meal plans is a good idea, because it's very easy to kind of say, oh, 30 minutes before a meal, 2 hours after a meal. But the reality is for our clients, you know, as they start to take their medications in closer and closer succession, as Parkinson's progresses, that can be a bit more challenging. So if that is a challenge, but you do feel that the protein issue is impacting how well your medication works, maybe connecting with a dietitian and trying to come up with plans for that, or again, you know, saving the protein until one point in the day where if it's not at night, you know, maybe you don't need to be super busy in the morning. So if you're not at your peak at whatever point in the day, timing your protein then. I find our clients are really creative in that area.
Yeah, you know, and just as you're speaking here, there's so many people on your healthcare team that help you manage your Parkinson's. And as Maria mentioned, there's the dietitian, there's a physiotherapist, you know, that's looking at exercise. There's occupational therapists that can look at equipment. You know, you have your GP and then your specialist. And, you know, it's important to have all these team members in and involved in your care. Maybe that's a good time to actually mention the Navigator book, eh, Maria?
Yeah.
Yeah. So in the Act on Time package that we had mentioned, it comes in a folder that's something like this. And inside the folder, there's a number of resources, but I'm going to highlight just a few of them here. So we have this Parkinson's disease, My Navigator. Everybody see that? Is that okay, Maria? Yeah.
Yep, that's great.
Perfect. And inside, it allows you to put notes about your visit, and it has a place for each member of your healthcare team to mention the dates and any notes, and you can put any notes in there as well. This will help you keep track. It's a really neat tool that may be helpful for you. Another little piece in this toolbook is this medical alert card. And it's just a little card that you can put in your wallet, and a place to write down all your medications so that people know what medication you're on. And another little great part is that it talks about medications that you should avoid when you have Parkinson's. And so they give recommendations in that. So that's really handy to have if you end up having to go to the hospital or something. Just have this little card so they know the medications you're on and they know what medications you should not be put on when you're there. And it also highlights at the back, too, how important it is to have your medications on time. And that's what our Act on Time kit is really promoting, is just really educating people, healthcare professionals, how important it is for you to have your medications on time every time.
Thanks, Shannon. That is, sorry, I was going around the screens, but that is great. And I think, yeah, Act on Time is one of the kits I think we're so excited about. It was launched last year, and it's, again, the challenges with accessing healthcare, making sure everyone is on the same page are some of the biggest challenges that we're hearing for clients. And I think not just even with Parkinson's, I think everyone, you know, I feel like, you know, in helping other individuals that I help out with their health issues, you know, having a navigator for anything I think is really important, because one specialist is not necessary, you know, making sure everyone's talking and sometimes also I mean, you're a nurse, you have a bit more background, but even maybe it's a bit more, but some of the information and the terminology that doctors use, or the medications that they all have big fancy names. So it can be hard to keep track of. And, when your neurologist is asking you what your family doctor said, and you're thinking, I don't know if I could fully explain what that person said. Having that navigator so they can kind of write notes to each other can be really helpful in sort of saving us the pressure of fully regurgitating what we've been told in all the fancy terms.
Absolutely. That's a good point, Maria. And also in the booklet, there's a Managing My Parkinson's Disease in Healthcare Settings. So I'll hold that up for a little minute so you can see it. Again, it highlights, visiting your neurologist, your GP, if you have to go to the hospital, what you do. Also, even living in long-term care facilities, some information about that. So again, another really good tool. And it's all on our website. And when we get more access to the office, these are things that we can mail out to you as well.
Shannon, are there any other questions that have been coming up for you lately, or topics that are burning?
No, I think, we've covered a lot of them here today. I think the number one thing, is people just not being able to access their specialists, or they think they can't. And I just encourage them, yes, please try, because many of the specialists are doing telephone conversations or telemedicine or video calling with their patients. So that really is one of the big concerns that people have. Yeah,
it is. I was on a call with a client earlier this week, and they're saying, I can't. They're saying that it's closed, and when I try and call, but some doctors' offices, it is just about being a little bit persistent. I ended up, for that person, just calling the clinic's office, and the clinic was of course closed, but they did have a voicemail, and I don't know how regularly doctors are checking their voicemails, but if there is an option to leave a voicemail, potentially your doctor will follow up with you. So, be persistent and do use all the options that are being provided. If the neurologist is saying, go back to your family doctor, then go back to your family doctor. But if there is an option to leave a voicemail, and take every opportunity that's available. Oh, and I think we have a question coming in. Sorry about that. Yeah.
Great. Well, there we go.
Constipation. So questions about constipation and rope-shaped stools. So rope-shaped stool, if I'm, sorry to be a little graphic, picturing that a bit, I think that might be it going through the intestines. So that might be, I think that it's okay. That's what you would kind of expect.
It may depend on maybe the size. Maybe they're referring that it's maybe a smaller bowel movement than they're used to. So yeah, constipation is a pretty common problem in Parkinson's, and we do have some literature on that. There's different ways of managing it. Of course, you probably all know to increase your fiber, increase your fluid, exercise. And if those things aren't working, then there are some medical or medications that you can take. So, you'd want to talk to your doctor specifically about what would be good to take. And some people do talk to their pharmacist. If you can't get to your doctor, the pharmacist can make some suggestions. There's sort of a hierarchy of things. You want to try the least aggressive thing first, and then go to something that, if it's been several days, then there'll be something probably a little bit more aggressive to manage the constipation. Have a look at, you can always call us and have a look at our website, because under our resources, there are a couple of great brochures on constipation. There's even one that has a recipe in there that may help to keep you a little bit more regular.
Yeah, we have.
Go ahead.
Sorry, Maria. I was just gonna reiterate that. So I would almost say that constipation, similar to pain, is this hierarchy where you take progressively more advanced steps. And we have on our website, under educational publications, a resource. It's called the Bowel Management Program, and it walks you through those steps. So starting with exactly increasing fiber, whether it's through your diet or a Metamucil type thing, and exercise and fluids. And then also then moving it up and into medical interventions, and again working with your doctor for that. But you can go take a look at the bowel management program. Always good to talk to your doctor before implementing any of those things, and the parameters around using certain constipation tools. Some you can use more regularly than others, and it's about really working with your team on that. But that can kind of give you a sense of how that would work. I think, yeah, constipation is one of the ones sometimes clients start having even before they have motor symptoms. And it's just this challenge, and it's like, also those something, it's easy to think of physical motor, slowing of movement when we think of walking, but that can also be slowness of muscle movements that are allowing us to pass bowel movements. So that could, that's what's going on there. Kind of going back to that thing about medication effectiveness, I think something that, people might not realize is also if there is prolonged constipation and we're not having that kind of gastric, release, that can also, if there's a buildup, that can also mean that medication isn't being absorbed as effectively. And I know that has been a challenge that has caused issues for clients in the past as well. Shannon, I see you nodding your head there.
Yes, absolutely. And that's a really good point, Maria, that it can affect the absorption of your medications if your bowels are not moving regularly. So again, like Maria said, if you look on our website, www.parkinson.ca, under resources, if you click there, you'll see education publications. Click on that link and you'll see a list of many things there, and you'll find the bowel management program. And there's another brochure on constipation too. So a couple of good resources there for you.
And then I am seeing, and I think we're getting close to the end of time, so I think this will be our last question, but it's about ideas or support for late-stage Parkinson's. So with late-stage Parkinson's, that can mean a lot of things and a lot of symptoms. So I think, Shannon, I'll pass this to you in a second if there's anything that you're off the top of your head, but I think really generally, because that can mean a lot of things, that might be a question that would be good to talk out one-on-one. So Mary, if you wanted to shoot us an email or shoot us a phone call, we could talk about the specifics of your mom's and what kind of support you're looking to provide. I think just to figure out what is happening as far as late stage Parkinson's. Shannon, do you have anything to add there?
Yeah, I think this is probably a very specific question, and I think Mary also had a question about home care that's not maybe taking on new clients right now in the situation we're in with COVID-19. That can be really challenging. I think probably it might be better to speak one-on-one. Certainly home care, if it weren't COVID-19, home care would be a great option to get that support in so that you're not all alone in doing the care for a loved one who has Parkinson's and advanced Parkinson's, which can be very challenging. And just having the right equipment, maybe even if they're not bringing in PSWs or other support workers in, perhaps there's some equipment that would make things a little bit easier for you. So maybe speaking one-on-one about this would be a really good idea.
Yeah, so Mary, please reach out to us. So I think that's probably where we'll end it. Shannon, is there anything that you wanted to throw in before we log off?
I think that we've covered quite a few things already, Maria, today. So thank you, and thank you everybody for joining us and being with us here today. And please keep looking at our YouTube channel and seeing the webinars that have been going on all week. Had some really great ones. I listened to, it was on Monday, I think it was the mindfulness, which has really been really good for, especially with the anxiety of the whole situation right now. And I found that really beneficial. The speaker talked a lot about anxiety and some of the symptoms that we feel with anxiety. And then she went into a little bit about mindfulness. And so I think that's really worth a listen to. And then we had one on dance on Tuesday, and yesterday was power moves, I believe. Is that right, Maria?
Yep.
And so, yeah, so there's a lot of great things. Just keep tuned in. It takes a little while to upload everything, but they will be there given a few days.
Yeah, exactly. So I think all of the programming will be uploaded onto our YouTube page. So if you didn't catch something, the majority, I think, will end up there on our YouTube. So just keep an eye out there. And yeah, it's been really exciting partnering Dance with Parkinson's, who is, an organization we partnered with in the past. They do amazing work. Did you get to see that documentary?
Yes, I saw it. I couldn't believe all the intergenerational, is that what they called it? Where the kids were dancing with the members of the class. I think it's really quite touching. I really enjoyed it. Yeah.
I've been to dance classes. It's the Dance with Parkinson classes, and they're amazing. And I danced before, so maybe a little biased, but they're awesome. And they're so. I found the instructors. There's this real emphasis on making eye contact and really, I thought it was a really incredible form of exercise. I always feel really warm and fuzzy when I think about that experience. And so it was nice to see that captured in that documentary. And then, yesterday was Power Moves with Randy, who I love. And she's here in Toronto, so I know her, and she's just an amazing sort of support for our clients and fantastic. So I'm so grateful that she's, running these classes for us, and, more people can benefit from her. I think next Monday we're having another mindfulness webinar at, that as well. And it's going to be on cognitive behavioral therapy. Our coworker in Montreal, Layla, has a social work background. She is kind of our go-to, I think, Shannon, when it comes to these and she has really taught us about how cognitive behavioral therapy can be so important for things like anxiety. So that is going to be great. So make sure to tune into that next Monday. And the other programming that's happening. And thank you to everyone who tuned in today. Great to see you and hear from you, and keep an eye out for things coming up. And just the same thing, I think we'll just end on as last week. So some of you may have heard some stuff today that resonated with similar to your experiences. We also, of course, had that example that some questions are a little bit personal, and it's hard to get into the full depth of a conversation through just a chat function. So same thing I said as last week. If you have any lingering questions, or we touched on something but you need a bit more support, please don't hesitate to give us a call on our 1-800 line. Hopefully that number is in the comments and it's visible, and also our email, info@parkinson.ca. And like we said, we can just give a bit more support and a little bit longer and a bit more tailored and individualized to your needs.
Good point.
Yeah.
And just again, a reminder, this is not medical advice. To always check with your family doctor, your specialist, before making any changes.
Well, I think that's it for us. So thanks, Shannon, and thank you everyone for watching, and have a great rest of your week.
Okay, thanks, Maria.
Bye.